All right, last chapter for this module, special senses. Now we also have sense receptors, but they don't have any organs. We have general sense receptors like heat and pain receptors and other balance receptors. But the ones we're going to talk about will have actual organs. So nose, tongues, eyes, ears, and of course in the ears you hear and also have an organ for the sense of balance. As mentioned, touch is generalized. We have endings for deep touch, light touch, pain, cold, heat, as prescribed in the skin chapter, integumentary system. So of course, going to the brain, is that afferent or efferent? Afferent, and then the brain will send a response out to the motor neurons, through the motor neuron. That's the efferent pathway. So if we block the signal going to the brain, will we sense the sensation? Right? It's all how the brain interprets the data. All right, olfactory. So think of smell. So in your nasal cavity, you have this porous bone plate. That's just what this cribriform means. It means there's a lot of holes in it because this bulb is where the nerve kind of bulges out, and through those porous holes, the nerves will extend into the upper nasal cavity. So smell is chemoreceptors. So we are detecting the shape, size of certain chemicals that are in the air. And our brain, once it gets the stimuli, will detect it as a particular smell. So the chemical must dissolve in that liquid mucus in order to activate the receptors. So here in the nasal cavity, the conch, right, so that gives it those projections that increases surface area, warms and moistens the air, and then activates the olfactories. All right, so you get the data, it travels along the tracts. So tracts is in the central nervous system. When they say nerves, they mean that's in the peripheral nervous system. So if you recall from when we talked about the nervous system. And then it is detected in the cerebrum. What does going nose blind mean?
Loss of smell.
Lost your sense of smell. Did you really lose your sense of smell if you go nose blind? So that's another word for sensory adaptation. So if you're sitting in your own bathroom, in your own steaming pile, right? You start to not smell it anymore, right? Because if your brain just keeps on getting bombarded by that information, then you can't really detect anything else. So that's what it means. You get kind of used to it. And then someone opens the door, they turn right back out. So you're in your teenager's room, right? They're in their room for hours and hours, musting it up. They don't smell anything bad. You walk in, and it's terrible. So that's just the sensory adaptation. Gustatory means taste. So taste buds are not the bumps on your tongue. Those are just the papules, right? The taste buds are actually in between the cracks. And just like a smell is chemoreceptors. Taste is also detecting chemicals, and you have to mix it with the saliva in the mouth in order to taste. So if you have a dry tongue, dry mouth, you can't really taste anything. It takes that little bit of a second for that food to mix with the saliva, entering the cracks between the tongue to activate the taste buds. So the taste buds will then activate the nerve, sends the signal to the brain. What are the different tastes? sweet, salt, bitter. What else? One more. There's just plain nasty. That's bitter mixed in with a little sour. One more. Right. Savory. So that's gonna be umami. So the term's umami. So that's like the ketchup taste, soy sauce, right? That beefy flavor. So 1, 2, 3, 4, which everyone gets. And there's certain concentrations of different tastes in different parts of the mouth, but you have taste receptors of all types everywhere in your tongue. There's just more concentration. So sweet at the tips, and then you guys like beer? You guys like your IPAs? So wine, you can just swish it around in your mouth and spit it out because you're tasting sweet and sour. But if you want to taste your IPAs, you actually have to swallow in order to catch those bitter taste buds in the back of your mouth. And then umami, which is I'm gonna activate glutamate. What's MSG? Is it good or bad?
Everybody says it's bad.
Okay. So, outside the Chinese restaurant, what the hell? They have the sign. No MSG added. Does that mean it's MSG free? No. So certain foods, certain processes of food, there's naturally occurring MSG. So if you're sensitive and it says no MSG added, doesn't mean there's none. It's just there's some already in like soy sauce, fermented foods. So they're just not gonna add any extra. Have you guys ever had the salt and pepper chicken wings? Okay, what do they sprinkle on it?
Salt and pepper.
And
Don't they put that accent stuff?
what is accent?
MSG.
MSG. So it's straight crack on the wing. So I call it crack wings. Because what it does is it activates the glutamate receptors in your brain saying, ooh, that's good, reinforcing that you want more crack wings, right? So you eat the whole entire tray. How many people get a headache afterwards? How many get a spike in blood pressure? Right? So that's the downside with some of these additives. How about spicy? Is that a taste? What does spicy taste like?
Heat.
It tastes like heat? Okay, what does heat taste like? Vinegar? No, they add. If you're eating buffalo wings, they add vinegar to the pepper sauce. But it's not a taste. It is, yeah, it's a sensation. So it's activating pain receptors, and then it acts as if you're having an allergic reaction. So you get that thick mucus coming out, right? Because that's to protect your body from getting more spiciness contacting it. So anytime you get that stringy saliva mucus, right, you're kind of allergic to that food. So like milk, when you drink milk, guess what happens? You get that slimy, stringy, because we're all a little bit allergic to milk. Here they're just saying where the taste is concentrated. So remember, bitter, you have to actually swallow your hopped beers. So here we have the taste buds, but in between the cracks, saliva and the food has to mix in order to get detected by the taste buds. So these structures here are the actual taste buds themselves. The bumps on your tongue, these guys, they're not taste buds, they're just papules. The bumps, yeah, they're for surface area. That allows the cracks to occur, and then the saliva, mucus, and food can then mix and activate the chemoreceptors. So you get that electrical signal, and then you either get sour. So let's say it activates this guy as sour, or this guy as sweet, this is bitter, etc. So activate the taste cells, goes to the cranial nerves. Here it's going to be in the cortex. So smell in the cerebrum, taste in the cortex. Vision. About 70% of all your sensory nerves are for vision. That's how important vision is. And for us, vision needs to be processed very quickly. You're getting millions and millions of points of data every split second, and your brain has to process it and put the image together. So you have to also learn to see. So if you're a newborn baby, you don't really see anything. You just see light and dark, and then the colors start to come in, and then you start to see size and shapes. So brand new newborn, until they're like 3 months, they can't really see past their own hand, like past 6 inches, and then their brain starts to piece things together, and they start to be able to see. So at 6 months, yeah, they should be able to recognize faces very well. The optic nerve. So in your eyes, you have a little blind spot where the optic nerves will exit the back of the eyeball. And then the vision center in the brain is actually in the back. So vision is processed in your occipital lobe, and that's way in the back of your brain. Light, think of lightning rods, and then the 3 layers, the outer, middle, and inner. We'll go to the image to take a look at those layers. 2 chambers. We have an anterior chamber and a posterior chamber. So anterior is the one in front. Posterior, the bigger one, is in the back. The whites. Sclera. So sclera means hard. So this is a tough area of the eye, and this is also where the muscles attach to the eyes. So you have multiple pairs of muscles to control the eyes. Where the sclera and the cornea meet is the limbus. The cornea is made out of keratin, and it's that first thing that will bend light. So you actually have 2 lenses in the eyes. You have the cornea that bends light, and then you have the actual lens itself. So right where the sclera and the cornea meets, right here, that is called the limbus. What happens when your cornea gets cloudy and you go blind? What is that called? Cataracts. So malnutrition can cause it to become fuzzy, opaque, and then you go blind. Really simple surgery. They cut a slit, take out the old cornea, put in a synthetic one or a donated one, and then within a day or so, they can see again. So if you know how to see and you become blind later on in life, and we fix your eyes, your brain already knows how to see. But if from birth you were blind and you never saw at all, and as an adult we fix your eyes, it's like starting as a baby again. You would have to learn what you're seeing. Corcoid, the middle layer. For us, ours is black and it absorbs all of the light. What happens when you shine a flashlight in a cat's eye? It reflects, right? And you see color. Well, theirs is reflective because they're night creatures. So for them, light enters their eyes and it bounces around to magnify night vision. Ours is dark, so we're daylight creatures, and that's to protect it. It absorbs all that light, doesn't blind us from bouncing that light around. The colors of the eyes for your iris. 2 types of muscles. So we have round muscles. So when they squeeze, your pupil gets smaller, right? So that's the hole in the center. That adjusts how much light gets into the eye. And then you also have muscles that are this way. So when they contract, they dilate the pupils. Ciliary body contains 2 parts. So it is the muscle and the ligaments. So ciliary muscles, ciliary ligaments together, they're the ciliary body. So depending on the shape of the lens, right? So it's made out of the same stuff as your nails and hair. So it's keratin, but the way it's structured, it's clear, it's transparent. And when we're young, it's flexible. And the ciliary body are the muscles and the ligaments all the way around that changes the shape of the lens. So it bends the light for us to focus. As we age, the lens gets harder and it's harder to focus because the lens is no longer flexible to accommodate for the correct angle. So accommodation is just a fancy way of saying focusing due to the ciliary body pulling on the lens itself. The retina is the projector screen. So just like the projector we're seeing here, if the image is not focused on that screen, you get a blurry vision. So nearsightedness or farsightedness is our inability to focus on the retina. Lightning rods. So that's your mnemonic device. So we have two structures in the eyes, rods and cones. So think of lightning rods. Cone starts with a C. So cones is for color. So that's how you remember which is which. So lightning rods detect light. Cone, C is for color. So more in your peripheral. So if you want good night vision, or if it's hard to see in the dark, turn your head slightly and try to look in the edge of your vision. You have more rods, then you can differentiate light and dark better. Contrastly, the cones, C is for color, it's for sharp image, so more cones are going to be concentrated in the center of your vision. Therefore, you can detect color differences and better depth perception. What's color blindness? Yeah, so we have three different pigments. It's just like a TV screen. The three colors, when they're blended, can make any other color. So if you're colorblind, that third one sometimes doesn't really pick up light very well. So you're only working with two of the colors. So all the greens and reds green, reds, and browns, they all kind of look the same. Anterior, front or back? Front. So the anterior is filled with aqueous humor. Humor is just a liquid. Aqueous means it's watery. So liquid in the eyes. The gel is in the posterior chamber. So it's going to be thicker. Vitreous, think of viscosity. Viscosity means resistance to flow. So it's more jelly-like. And it's designed to keep the retina pressed up against the back of the eye. So if you didn't have this jelly filled in your eye, the retina can actually detach from the back of the eye. So a lot of athletes who get hit in the head, hit in the face, football players, they might get their retina attached, and in order to prevent them from going blind, they'll inject their eyeball with something to replace that jelly, to press it back up against the eye so it doesn't attach permanently. All right, so the white is the sclera. That's where the muscles will attach. Just remember the cornea and the sclera junction is the limbus, just this area here. Now covering the front of your eyeball and your inner eyelids, the inside of your eyelids, is a mucous membrane called the conjunctiva. Ciliary body, that contains the muscle and the ligaments. So here are the muscles, and these stringy things, those are the ligaments. So they're designed to push and pull and change the shape of the lens in order to focus on the retina in the back. So whatever you see as it goes through the lens, it gets inverted, but your brain will fix it in your head. The bones. So it creates a bumpy ridge to protect the eyes. Now I've done this, don't like to admit it, but sometimes when I open the door, I have my head in the way sometimes, and I bang myself right here. If we didn't have that bumpy ridge, we would damage our eyes. Also, it channels sweat away with help from your nicely plucked eyebrows. Eyelids. So some people will develop a fold in the eyes called the hippocampus fold. So if you're in regions where there might be sunlight, so the upper eyelids will actually get a little droopy, and that creates like a natural hood, and it shades the eyes. Pink eye. So the mucous membrane can get infected. So conjunctivitis is when it's infected. Tears, lacrimal apparatus. So you have your tear gland here, your lacrimal gland, and it'll produce its liquidy tears to help flush the eyes. So if you're irritated, get something in your eye, it'll help flush it out. And if you're sad, then that's just an autonomic stimulation. They drain into your nasal cavity. So anytime you cry, your nose will start to run because that excess liquid is going to drain into your nasal cavity. For drugs that are for the eyes, you want to prevent too much because applying too much because they might drain into your nose, back of your throat, and then you swallow the medication, and it's not intended to be used that way, just in the eyes. Three pairs. So you got 6 muscles per eye to move the eye up, down, left, right, in and out. So as your eyes recall on the cranial nerves, it was like 5 or 6 of them, of the cranial nerves will actually control something in the eye, sensory or motor. Refraction means bending of light, just like through a magnifying glass. Light is bent through both your cornea and the lens. So that image is upside down. When you do your microscopy lab, you'll learn how to use the microscope and shift the slide, and it's absolutely the same, upside down and backwards. You guys ever heard of deja vu? What's deja vu? Yeah, so it's kind of weird. Your vision and where it's processed in the brain, it kind of crosses. So whatever's on the left side of your brain or is processing what's seen in the left side and vice versa. So that means you're going to be making 2 different memories every time you see something, kind of, right? Because whatever's seen in one eye is processed on the other side of the brain. So in deja vu, one side of the brain just records that memory just slightly quicker, and you kind of feel like, hey, I've been here before. So it's just a trick of the mind. But in the Matrix, they changed something. So if you see the black cat, the same black cat, identical black cat, or a different black cat, right side up. So your brain will interpret the data as needed. Aging eyes, less tears, the lens and cornea becomes harder, so more difficult to accommodate. You got to use your bifocals, and then once it gets worse, you got to use your trifocals, right? So regular vision, you need a different set of lenses to see far and a different set of lenses to see up close. Elderly patients, you're going to have to use softer lighting. And recall the nervous system and muscles, you're going to have to keep it a little bit warmer for them as well. So special consideration in the reception area for aging patients. Stigmatism. So the cornea is oddly shaped. So if an object is round, once it goes through your weird lens, you might see it as a half moon shape. They can help it with some contacts, some corrective lenses, but there's only so much we can retweak your cornea or lens. You have that? So your corrective lenses helps a little bit. Some people with astigmatism, there's nothing they can do. Dry eyes, they'll just give you drops. There's also medication to help stimulate your body's own production of tears. Ect means to the outside. So your eyelids popping outwards. And then N means to the inside, so your eyelids can pop to the inside. All right, let's get started on the ears before break. So there's three parts to the ears. So you got the external ear. All right, dividing that from the middle ear is your eardrum. So anything from your eardrum outwards is external ear. Between your eardrum and the oval window is your inner ear. So the dividing marks are the tympanic membrane, eardrum, and the oval window. Don't get it confused with the round window. So external ear first, anything from the eardrum outwards. So the ear itself that you see, this thing that's made out of cartilage and flesh, some people have attached lobes, some people have unattached lobes. So that's called the pinna, aka the auricle. So cone shape, and we talked about smell being chemoreceptors. We talked about taste being chemoreceptors. Vision was photo. I didn't mention that. But you're detecting light. So vision's photoreceptors. But in the ear, we're going to be detecting sound wave. We're detecting pressure. So it's going to be mechanical receptors. Lined with hair. That's to prevent bugs from getting in. And the wax. The wax coats the inside of the ear, preventing bacteria from gaining a foothold, forming a biofilm and infecting the ear. And then the boundary is the eardrum, the tympanic membrane. So that sound wave funneled in by the ear will vibrate the tympanic membrane. So that vibration is mechanical energy, hence mechanical. And it'll vibrate the bones in the ears. So we have three little bones called the osticles, the malleus, incus, and stapes, sometimes called the hammer, anvil, and stirrup. So they'll vibrate and they'll magnify that vibration and they'll pound on the oval window. And that marks the separation between the middle ear and the internal ear. So the internal ear is where you'll have the actual organs for hearing and balance. The middle ear. Why do kids get ear infections? Because they're dirty, right? They're nasty, dirty kids. It all has to do with anatomy. So when you're a kid, you have a nice round head, and the tube, the eustachian tube, aka the internal auditory canal, right, drains to the nose. So anytime you go up and down in elevation and you hear that pop, that's the pressure draining from your middle ear through your eustachian tube. So for little kids, because they have rounder face, if they have any infection, any mucus in their nose, it can back up the eustachian tube into the ears very easily. As you become an adult and your facial features elongate, the tube kind of closes off and it's harder to get any bacteria or infectious material back up into the ears. So the doctor will say, yeah, the kid will grow out of them, and usually they do. Oval window is going to vibrate, and that pressure from the vibration will move the liquid in the inner ear. Right? So that liquid, as it moves, it'll shake some hairs, and it's the hairs that will send the electrical signal to the brain, and you'll interpret it as sound. So here in the image, so we have the external ear canal. The eustachian tube is also called the internal ear canal. So here's the tympanic membrane marking the end of the external ear and beginning of the middle ear. The oscillals, 1, 2, 3, will vibrate, magnifying that vibration and pounding on the oval window that marks the beginning of the inner ear. So sound is detected in the cochlea, this shell-like shape, seashell shape, snail shell, and balance is in the vestibule. So this pressure will cause the fluid in the ears to move, and lining this spiral is a bunch of little hairs. And as the hair vibrates, they'll send that electrical signal to the brain. So that mechanical pressure energy is converted into an electrical signal. Here in the labyrinth, you have 3 semicircular canals, and they're all in 3D space. They too are filled with liquid and lined with hairs. And depending on which hairs are activated, you can determine your orientation in space. Have you guys ever spun on an office chair and then you stop? It felt like you're still going, but are you moving still? No. What's going on is the liquid in your inner ear is still moving, still activating the hairs, and it's telling your brain you're moving, but you're not. Okay? Semicircular canals, so you got 3 of them, all in X, Y, and Z plane. So vestibule for equilibrium, cochlea is for hearing. So the organ for hearing is called the organ of Corti. So that separates the endolift from the perilift, the liquids. So banging on the oval window will cause the fluid to bounce. It bounces in the center of the snail shell, and then once it hits the center, it'll bounce back out through a different fluid channel, and then it'll hit on the round window. So here you are playing that baseball game, right? Spin your head on the baseball bat, hit the ball off the tee, and then run around the bases. So the liquid in your head is still moving, but your body is not. So seasickness, motion sickness, what you're feeling in your ears and what your eyes are seeing don't equate. So your brain goes crazy, it doesn't like it, you get nausea and vomiting. So the best way to prevent that is to focus on something in the distance that's not moving. So if your vision is not moving, it tricks your body into thinking that your body's not moving. External ear. So mechanical funneling of the sound, vibrating the, then it bangs on the oval window. Just a summary. For ear protection, you can use the ear plugs or the ear muffs. The best is to use them in combination. So the ear plugs are good at blocking sound waves in the air, but you can also get sound that goes through dense bone. So where does sound travel faster? In air or in bone?
Wouldn't it in air?
Let's see. Here's one air molecule. In order to transfer sound, I have to go way over here to the next air molecule to hit it. So it can then travel way over there to hit the next air molecule. Whereas bone, I'm here. If you hit me, guess what? The guy next to me is going to move too, right? So where do you think sound is going to travel faster? Underwater, in air, or through bone? Yeah, so it's denser, it's going to travel quicker. So if you just use earplugs only, you can still damage your hearing. The best is to stop the bone conduction with the earmuffs over the top.
Is that why a lot of youngsters love the bass?
Yeah, well, bass, you can't hear bass. So low tones, it's hard for us to hear low tones until the bass is up really, really high in decibel. So you'll probably feel the bass before you can even hear the bass. So little kids, musicians, those always on their earphones, I can't hear anything, so they turn it up, turn it up. Because for us to hear bass, you have to turn it up really, really loud. So, in Justice for All, what did they do to the bass? You don't like Metallica? They turned the bass down. So you can't even hear Jason on the bass. So that's why music is crappy. There was a loudness war. So all the highs and lows of music, they made it compressed, and now all you hear is bass and everything's super loud, but you don't get the crisp sound anymore. External ear, drier wax, so you might get an impaction. Easy enough. There's stuff to help clean it out. There's soaps, dissolvents of the fatty wax. Don't use the Q-tips. You're not supposed to enter the inner ear. You're only supposed to clean the outer portion of the ear. If you use the Q-tip, you tend to impact the wax, making it worse. The bones can become hardened or either further calcified. So if they're hardened, they can no longer vibrate to transfer the sound to the oval window from the tympanic membrane. Babies. Babies who usually don't babble or coo, usually it's not because they have a speech problem. It's usually because they have a hearing problem. They can't mimic. So you really need hearing in order to speak. So 4 months, yeah, they can recognize voices. And how soon can babies talk? Say words like mama, papa. How young? 8, 9 months? Well, that's not them. They have no idea what they're saying. It's just them learning to make sounds, babbling and coo sounds. So it's usually repetitive sounds, mama, nana, dada. That's just them practicing. But I've seen a lot of parents who always argue with each other. No, he started talking at 4. He said mama, mama at 4. But they didn't put 2 and 2 together. It's just them practicing making sounds. Because in every culture, there's a word for grandma that's a repetitive word, right? Nana. There's mama, papa, dada, right? It's just them babbling and cooing. They have no idea what they're talking about. It's not only until a year or so, then they'll start recognizing the first one, right? No. 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 And then start to learn to talk. So if you want, you can teach them sign language. It might delay their speech development, but it'll allow them to express themselves quicker because it takes time to learn your speech. Tumors anywhere in the ear? Wax impaction. So Q-tips, don't press it too far. Hearing loss. The sounds you'll lose first are going to be the low sounds because those are the hairs at the beginning of the cochlea. Infections. So swimmer's ear, the outer ear gets infected. We already talked about the middle ear infection in children. And then dangerous is an inner ear infection. Usually really painful, both of these, middle and inner ear, and then that can lead to deafness. Hardening of the bones, so the osticles get hardened. All right, not too bad for special senses. Let's go ahead and work on week 4, day 1.